She pushed hydralazine through the arterial line. A friend who is a nurse.
Hi, my name's Ashley. I'm an ICU nurse, and I teach tips like this all the time on my page. I love that this nurse is talking about this because it's so important to share other nurses' mistakes so that you don't have to make them firsthand. That doesn't mean that we need to shame people or look poorly on them. It just means that, hey, this is an opportunity to learn and grow from and become a stronger, better nurse from. So, in general, most medications, like the medications that you are giving at the bedside as a nurse, should not go through an arterial line. There are a few exceptions in procedural areas like cath lab and IR where you may give some medications through an arterial line source. But in general, as a bedside nurse, we are not pushing meds through arterial lines. And the reason why is because you have your heart, right? And then you have arteries that lead from the heart. This is taking that oxygenated blood away from the heart, carrying it to all the necessary organs and tissues. And those arteries turn into arterioles, which turn into the capillary beds, which turn into the venules, which then turn into the veins, which carry blood back to the heart. So when we give IV medications, we are pushing these through a venous source because veins lead back to the heart. Arteries lead away from the heart, which means it's going to take longer for that medication to actually get back up to the heart. It also means when you're pushing a medication through an artery, that artery is going to get smaller and smaller and smaller until it turns back into a vein. Whereas veins, when you push a medication through a vein, that vein is going to get bigger and bigger and bigger because it is leading back to the heart. We don't want to give medications through arteries in general because those arteries turn into little tiny arterioles, and medications need to be dispersed out and diluted. They don't want to get caught and trapped into those little tiny capillary beds, especially your vasopressor medications and all of those inotropes and things that are very, very harsh on the vessels. And that is why we don't give medications through an arterial source in general.